Hello, I'm Dr. Oscar Menendez. I'm one of the chairpersons for this year's Mission of Mercy event.
How you doing? I'm Dr. Chris Bolness. I'm the other chairperson for this year's Florida Mission of Mercy. We would like to welcome and thank you for volunteering.
The Mission of Mercy event is the Florida Dental Association Foundation's premier charitable event. We're hoping to treat about 2,000 people at this year's event and provide around $1.5 million worth of dental care. We are doing this in hopes of giving these people self-respect, dignity, and eliminating pain.
This year's Mission of Mercy will be held in Lee Civic Center, March 9th through 10th, 2018. It's a great event, it's fun, and we thank you for coming.
We hope to see you there.
Greetings, my name is Steve Zuknick. I am the Co-Clinical Director for the 2018 edition of the Florida Dental Association's Mission of Mercy in Fort Myers. Thank you for your dedication and volunteering to help these patients in need, and you are very much appreciated for making such a big difference in their lives. I'm in charge of the preclinical areas for this event. Those areas consist of patient registration, patient education, medical triage, radiology, dental triage, and patient routing. Please be on the lookout for a series of emails in which you will receive information and a link to protocols specific to the department in which you volunteered. Familiarize yourself with these as well as the site plan of the venue and the clinic floor so you can be made aware of your duties as well as where you are to perform them. You will also receive important information you should know before you arrive on the day of the event. Proceed to Whaley Hall and check in with volunteer registration where you will receive a shirt and a name tag. You will then proceed to the Lee Civic Center and go to your specific department and check in with your department lead. They will provide a verbal orientation with the rest of your shift. Your lead is there to assist you and help you have the best experience possible. But please help them by being as flexible as you can be. We are all out of our element, but what you are providing for our patients is beyond fantastic. Thank you again for being a part of the Florida Dental Association's Mission of Mercy, and I look forward to personally seeing you in Fort Myers.
Hello, I'm Dr. Tom Brown, and I'm the manager of the Endodontic department at this year's Missions of Mercy event. I'd like to start by thanking you for volunteering your time and your talents to help all the wonderful people that we're going to reach at this year's event. It's going to be great, like all the events we've had in the past, and I'm sure you'll really enjoy it at the end of the day. This video is designed to help review some of the protocols for our department so that you're familiar with that before our event. Please also look at your written protocols just to review in case there's anything I overlook. First of all, the teeth that we're going to be treating are anterior teeth only. Very select premolars if they're very straightforward and can be easily restored with composite, no molars. We're looking for teeth that we can make sure are going to hold up nicely with that composite restoration afterwards, since we don't have the ability to do crowns. So we'll be pretty selective in what we'll be able to treat. When you receive your patient, they should come with a registration form, review their medical history, any anesthetic that they may have already used from another procedure, if somebody's had a curious exposure or such like that that you would need to know about, administer any additional anesthesia that you would need, and proceed with treatment. We should have all the instrumentation that you would need to perform the procedures from start to finish, but if there's anything that you particularly like, any particular rotary files that you prefer, please feel free to bring those, and we can sterilize and return anything you need that needs to come back to you. When you perform treatment, please remember to fully fill out the patient's encounter form with the dental codes and the tooth numbers that you have treated. Make sure you sign the form. Also remember the anesthetic that you've given. When you've completed treatment, you will escort the patient to the registration for our section and check out for our section. If they need a more complex composite restoration, in other words, just anything other than like an ideal access, something that might take you a bit of time to restore, they can be taken to restorative for that procedure. If it's a pretty straightforward, quick restoration of that access, go ahead and place that composite to help expedite the patient flow and allow us to see more people. But we also have the restorative department for that if we need it. Should a patient need any kind of medication prescription, which would be unlikely, we do not have an on-site pharmacy. Please let me know, and we can arrange to write a prescription that the patient will have to get filled at their own expense off-site. At your station, you will have some colored cards that will help communicate when you might need a patient. As example, it would be the green card. The red card would be to have an ambassador escort the patient to the exit interview or to restorative. That'll be handled mostly by the people at the checkout, though. If you have any equipment concerns, there's a yellow card to signal somebody to come in. At your station, you will have the capability to take individual PAs as needed, intraoperative and postoperative. So that should be a pretty efficient process. In the event that you need an EMT, there's a white card with a red cross. If you need a translator, there's an orange card, and there's a purple card if you need an x-ray, but again, you should have your own sensor, and there should be no MAD units available, so that will be pretty straightforward. Again, thank you for your participation in this event, and if you've not participated before, you really are in for a great treat. This is a rewarding event, and everybody that participates has nothing but positive things to say about the event. Thank you.